When I was a very young student here in the United States, when I was a very young student here in the United States, and I was obviously not knowing about many things, and one of the questions posed to us in the classroom was, how many races are there? And young students, new students, we didn't quite know how many. I mean, wow, I just met a Chinese person, Japanese, black, white, and all that stuff. And what it boils down to is, the answer is there's only one race, and it is the human race. Okay. So from the two talks, Jeff's and Ali's, we determined that there is inequality in healthcare. There is injustice, not just in the access, but equality. I was born in the Philippines. I came to the United States in 1971, November. I just turned 18 and 4 days old. And now that I am 63 years old and thinking back my life and where I am right now, and especially several days after my 63rd birthday, the election, maybe I am still not out of my depression. Just kidding now. Yes, I'm not still out there. And the depression is not clinical depression per se, but it's the kind of depression where I say to myself, why? Why in 1965, when our foremothers were able to make a decision whether we should cover everybody, why didn't they? Why did they choose people who are just 65 years old and over? How could we possibly have said it was okay? And worse, it's still happening. 50 years more after Martin Luther King said that, it's still happening. What the heck? Right? I don't cuss. My husband can vouch for that. The first time I ever cussed was when my IV line was not dripping when I was having my C-section. And I said to the nurse, fuck that line, it's not going in. Well, anyways. Okay, here we go. I hope I have whetted your appetite, because today, what I'm going to do is I'm going to help you talk to others. Because sure, we have all this knowledge now. Pharma is not good. They're bilking us with money. Medicare and Medicaid, we're changing. So, okay, so this is it. This is how we're going to do it. When I went to Washington, D.C., and there were so many classes offered, I chose the ones that I knew would help me. How am I going to communicate with you? And how are we going to do it? Okay? So, the stories that we have heard so far Jeff says he's having a difficult time with his patients following through because they don't have the money to buy the medications. Ali is having a difficult time. Both of these are physicians. I'm a nurse. I have a different take. The pharmaceutical companies, all the researchers, have done all these studies about what medications there are supposed to be, what medications are we supposed to be giving for certain diagnosis. Last night, we just saw a presentation on Toujeo, an insulin that is is it a long-acting insulin? It's a long-acting insulin, just like Glargine, but somehow or another they changed it. Okay, so fine and dandy. You can have all of that, but if the patient will not take it, it's not going to work. So here we go. This is how we're going to do it. I am going to divide my short talk, and this is actually the beginning of my talk right now, by first telling you that we need mass movement. There is no going around that. If we are going to make any changes, it has to be mass movement. Number 2, we need to know how to reach out. And number 3, we need to make it happen. Okay, so first, if we're reaching out, this is from what I learned now from Washington, D.C., from the talks that I went to. Who are we reaching out to? The answer is everyone. Right. Everyone. And the who is going to also become different by who is reaching out. Who is reaching out to who? For example, physicians. Ali and Jeff will reach out to their physician colleagues. And nurses will reach out to nurses because we can speak their language. My family, a lot of them are working in postal service. They will reach out to their coworkers. Students will reach out to students. Organizers will reach out to organizers. And guess what we have in common? We have family. We couldn't have come out of this world without a family, without a mother, unless we came out from the tube. So we start with a family. Okay? Family, and then friends and colleagues. Strategy. We need to get to know our audience. How do we know that? How do we do that? When I was there in Washington, D.C., I approached the senator. I have him here in this picture. Jeff took this picture. And this was when we were in front of 950 F Street, where the pharma lobbyists were in. I didn't know that Jeff took it, but right behind me was the same senator who I asked a question to. And the question I asked him was, Senator John Marty, he's from Minnesota, I believe, correct, Jeff? Okay. He's the senator from Minnesota. I told him that I have spoken with my family, with my friends. I've asked them to write letters. We've gone to the legislators. We've gone to Sacramento to talk with them about Singlepayer. What's next? What can you do as legislator to make sure that single payer happens. And guess what he said? He said, we need to hear your stories. It goes down from the beginning of our talk, and from the stories that you've given, from the stories that we've heard so far from this room. We need to tell these stories. And these stories, they're not published. They are stories transferred by oral tradition. And I believe that these stories, if each one of us will tell these stories, there are two things that happens. One of my projects with some of my young nursing students who do not know how to relate with their patients, I tell them, tell a story. And have your patient tell you a story. Because that telling a story allows that human connection, allows that knowing. Races are blurred when you tell a story. And guess what? Why do you think mothers and fathers tell stories to their children? It's relaxing. When you tell a story to someone, they listen. They will listen. From my classes that I went to, there are a couple of things that I would like to share with you that they said could help when you're talking with someone. Okay? Let's call them, first of all, finding the common ground. They taught us during that class that there's a continuum from liberals to conservatives. A liberal would say equal opportunity. The conservative would say government overreach. The liberal would say fairness. The conservative would say longer lines, higher cost. The liberal would say nurturing. Conservatives would say moral hazard to support choices. The liberal would say healthcare is a right, not a privilege. The conservative would say undermine individual responsibility. The liberal would say, you heartless conservatives, you just don't care. And the conservative would say, you bleeding heart will destroy America. Okay, so know your audience. Second thing that they taught me in that class is know your audience's comfort zones. Okay? And first of all, before you try to understand another's comfort zone, you better know your own comfort zone first. That's what I teach my students too. Before you can understand somebody else, you better understand yourself first. Okay. Say, knowing your audience's comfort zone, 4 F's. Facts. Oh my God, it's not the other F. Okay, there's no dot in there. No F's like that here. Facts, futures, forms, and feelings. Okay, those are your 4 F's. I said, what do they mean? Facts. Some people are into facts. Today we had so many facts. Doctors love facts, right? Oh, doctors love facts. How about nurses? What do you think? Nurses. I don't know if there's another nurse here.
Right.
Well, not quite. Facts and feelings for nurses. The first day of class for my students, I taught them from the very beginning. You can have all the information, you can know all the things in the book that I'm giving you for your textbook. But if you are cold and uncaring, you are not going to be a good nurse. I will actually flunk you in clinical if I see you being cold and cruel to your patients. And for a nurse to actually fail a clinical, the student nurse will have to repeat the theory plus the clinical. So it's not an empty threat. If I see them cold, uncaring, and cruel, they will not pass my clinical. So others are into futures like concepts, vision, purpose, strategy, and global. Meaning someone who is more cognitive and philosophical and ones who talks about mathematical theorems. Futures. Forms. Methods, regulation, quality control, timing, and policies. Possibly I could think of a manager for the forms. And then the last one is feelings. So your 4 Fs. Know your audience's comfort zone, especially your comfort zone. Alright. So far so good. Am I not losing you? Sometimes I do this with my students. I say to them, if you feel like you need to stand up, do so. Or if you need to go to the bathroom, just don't trip onto somebody else's chair. Okay, so the other thing that I'd like you to also learn from what I have learned is now we are going to actually frame our word. Okay, frame our sentence. From my class, they're saying that loss aversion works better. Okay, so here's an example. A gain-centric message would read something like, save money for the future you want. Okay, save the money for the future you want. The loss-centric message would be, stop wasting your money. Gain-centric message, see any doctor you want. Loss-centric message, why should insurers pick your doctor? Gain-centric message, live longer and healthier. Loss-centric, don't die younger than you need to. Okay, now applying the loss aversion formula. Which surgeon would you pick? If I describe my surgeon as someone who has a 95% chance of success, as opposed to my surgeon who has a 5% chance of failure. Who would you choose? Okay, so another start that I would like to emphasize to you right now is don't just dwell in your own comfort zone. Vary it. Okay? Another thing that I learned, which I think will be important or helpful, is from Dr. Robert Czar. He is the outgoing president of PNHP. And this is what he said. For daily, for what you do daily in terms of moving Singlepayer forward, this is what he said. Listen, be patient and compassionate. Be kind to yourself and others. Give sound advice. Stay on message. Redirect. Keep it simple. Use language they understand. Don't let anybody hurt or use you. And lastly, take care of yourself and others. That's from Dr. Robert Zarr. Now, the third leg of my talk, number 3, make it happen. Is this long enough? Okay. I want you to take a look at this chair. Okay. If you were one of my students and you were a nurse, I would say, student, what do you see? And the student would most likely say, Mrs. G, are you trying to trick me? That's the chair. And for this particular talk, I would like you to see that there are 4 legs.